Hello, today we will talk about genital herpes. Again, quick little lecture here for the OB-GYN module. Gotta know your bugs, gotta know your drugs. All right, a little bit of background. Genital herpes is a common sexually transmitted virus worldwide. Can be caused by the herpes simplex virus 2 and 1. Antiviral therapy can shorten the duration of the symptoms and signs. Unfortunately, clinical recurrence is common. So let's get into it. After the primary episode, genital HSV can recur frequently, especially those that are infected with the subtype 2. Over time, the recurrence typically decreases in frequency. And then also to just note, the antiviral therapy does not change the biology of the latent HSV. So here we go. First line therapy, antivirals. We have acyclovir, famciclovir, and valacyclovir. They all have similar activity against the HSV, herpes simplex virus. And the safety and tolerability are excellent with all three agents. So just note there is some difference in the bioavailability, but as far as them all being equally effective, you can go with any of these three. They're all considered to be equal as far as evidence-based medicine is concerned. So, like I said, any of these three can be chosen, any of these antiviral medications. However, the valacyclovir is the most convenient in that it is just twice daily dosing. So like the acyclovir, I believe, is like 5 times a day, and the famciclovir, I forgot how many times it is too. But the valacyclovir may be preferred because the patient does not have to take as much, so you can do the BID dosing on that one. But for testing purposes, make sure you know all three for first-line treatment. If a patient does have recurrent genital herpes, you can look at kind of what's going on with them, the severity of the symptoms, and how frequent they have their recurrent symptoms. In patients with more than 6 recurrent episodes per year and or severely symptomatic disease, you can do a chronic suppressive antiviral therapy. So the valacyclovir, can be advantageous because it has a once daily dosing for this indication. So again, if you want to do if it is a more recurrent, so remember before, the valacyclovir is twice daily. This is for that primary episode, but then if it's recurrent, the valacyclovir can be used once daily. For the patients who have less than 6 recurrent episodes per year and moderately symptomatic disease, you can do episodic antiviral therapy rather than chronic suppression. And again, notice same drugs, antivirals, acyclovir, famciclovir, and valacyclovir. You can, for this specific patient subtype, you can do single day therapy with famciclovir, and that may be convenient. So single day, and it's going to be a gram twice a day or 1,000 milligrams twice a day for 1 day. Or you can go with a 3-day course of valacyclovir, and that'll be 500 milligrams BID. But again, for studying purposes, it should be pretty straightforward because it's those same drugs over and over again. And like I said, the acyclovir, it's still good and it's still prescribed. It's just you have to dose it more frequently than some of these other ones. So patient preference also needs to be considered. And then their insurance, or if they've had issues with one of the medications before or whatever. And the presence of severe psychological stress related to these herpes outbreak may favor the suppressive therapy. So again, that'll depend on the patient if they have a lot of stress and anxiety because of these outbreaks. And that'll be regardless of their frequency. So that may also influence your decision as far as your strategy in treating the patient. You may not need to give any pharmacological agent, depending on the patient, especially if it's an infrequent episode and or minimal symptoms. And the good news is, for immunocompetent people, the antiviral drug resistance is not an issue like we've seen with some of the antibiotics. And so again, all those three I listed before, the acyclovir, famciclovir, and the valacyclovir, don't have to be as concerned with drug resistance. So that is it for the quick presentation. Like I said, focus on the bug and drug, and you should be good for my exam. Thank you guys for your time and attention, and always feel free to email me if you have any questions, comments, or feedback. Talk to you guys later. Bye.